Hello and welcome to the launch of the OECD Country Policy Review, Strengthening Early Childhood Education and Care in Ireland, Review on Sector Quality. The report is an independent expert assessment of policies for early learning and care in Ireland, with a particular focus on the quality of provision. We are very grateful to the OECD for carrying out the review, which we asked them to do as part of Ireland's participation in the wider OECD project, Quality Beyond Regulations. We are also very grateful to the European Commission, which supported the undertaking of this country policy review. The full report is now available on the OECD website. In this short video, we will first hear an overview of the report from Andreas Schleicher, who is the Director for Education and Skills at the OECD, and is also the Special Advisor on Education Policy to the Secretary-General of the OECD. After that, the Minister for Children, Equality, Disability, Integration and Youth, Roderick O'Gorman, will respond.
Hello, and thank you for inviting me to speak to our review on the quality of early childhood education and care in Ireland. At the OECD, we have been looking at early childhood education and care, or you would call it early learning and care, in Ireland for over 20 years now. You can see here on the chart how enrollment in the sector has risen over that period. But it's not just a quantitative expansion that we're talking about. We've also seen a real shift in the attention of policymakers from access to quality and from care to learning. And that shift is based on very solid evidence. You can see here on the chart that emergent literacy and self-regulation are very strong predictors of success among different later life outcomes. And there are also clear relationships with emergent numeracy, pro-social skills, including empathy and trust, and also non-disruptive behavior. We're not just talking about early childhood education making a transition into primary school easier. No, these outcomes, these fruits of early investments, are born much, much later in the life of people. Drawing on another synthesis of longitudinal data, we can see here the effects of targeted programs for disadvantaged children in the United States. These programs tend to have a strong focus on children's social emotional as well as cognitive development. The difference in adult earnings between those who participated in one of those programs and those who did not is up to 25%. We now also have got some really interesting evidence on the positive flow-on effects on program participants' own children, which gives you a sense of the intergenerational trajectory. Our starting strong publication, the 6th edition that came out in July this year, tries to understand how policies can support the quality of the interactions that children experience in early childhood education and care. We call that process quality. And Ireland is currently putting a lot of emphasis on that. Now, with the adoption of the First 5 strategy for babies, young children, and their families, now covering the period from 2019 to 2028. And with that strategy, the country has committed itself to improving not just access, but also quality and affordability of early childhood education and care provision. And that's encompassing related work and reforms on the workforce, the funding system, but also home-based provision, and also the governance of the sector. So Ireland asked the OECD to conduct an in-depth review of the early childhood education and care system with a focus on those policies that can support quality. So to set the context of this review, despite a real increase in public funding over the past years, expenditure on early childhood education and care in Ireland remains really quite low, as you can see here. Annual expenditure per child in 2019 in Ireland was really well below the OECD average. $4,439 compared to $10,118. And that's public, not-for-profit, and for-profit settings altogether. And you can see here that among OECD countries, Ireland has one of the highest levels of childcare costs for parents. And again, the data here cover public and non-for-profit and for-profit settings. In Ireland, most centre-based services are offered by private providers, no? And outside of the pre-primary programs, or you call them ECCE programs, which are free to parents, it's the providers who decide on the level of parental fees. But while costly to parents, the Irish early childhood education and care system has important strengths, including a child-centered and also a research-based early childhood curriculum framework that covers all children from their birth up to the age of 6. But also policies to support the professionalization of the workforce and the quality of initial education and training for new staff. And also a range of quality assurance arrangements and inspection, covering both structure but also that process quality, the quality of the interaction, which is really, really important. So these are strengths to build on. Beyond the level of qualification, the number of areas covered in initial education programs is important to ensure that staff develop those skills and also the knowledge on many aspects of the job. The breadth of initial education program in Ireland is comparable to that in several other countries that we studied, and more extensive than in some of the OECD countries, in fact. In Ireland, the breadth of coverage is similar for teachers, or you call them wisely room leaders and assistants now. But, and this should not be overlooked, requirements and incentives for room leaders now, who are employed in the pre-primary programs have led to a situation where babies and toddlers are then educated by less qualified staff. Now you can see here the yellow bar representing the youngest is much shorter than the blue bar for pre-primary programs. So one way the pre-primary sector has, basically consumed all of those qualifications and leaving the youngest children often with less qualified staff. And then add to this high staff turnover. And that's a challenge in many countries. Now, data from our Thales Starting Strong survey, they're from 2018, show that in Iceland, Japan, and Korea, leaders reported that approximately 1 staff for every 5 children left the center in the previous year. In Israel's centers for children under the age of 3, the proportion is almost 1/3. However, in the rest of the countries, in both pre-primary centers and centers for children under the age of 3, only around 1 staff member per 10 current staff left the center in the previous year. Unfortunately, Ireland does not yet participate in our Thales Strong survey, so we don't have comparable data. But we were told that high turnover is also an important challenge in Ireland. In fact, national data show that the turnover rate, and by that I mean the percentage of staff who left the center in the past 12 months, was estimated at 18% on average across the country, and it's 38% in Dublin County. That's higher than the highest country for which we have national data. Our analysis shows that professional development adapted to staff initial preparation, experience, and role can help them effectively engage in meaningful interactions with children. Several countries have requirements for participation in professional development. For example, a mandatory number of hours or certification that is conditional on such training. That's not the case in Ireland. Ireland also does not regulate the monitoring of quality of professional development, as other countries do. And the assessment of staff professional development needs and also barriers to participation doesn't seem yet common practice in several of the participating countries, including Ireland. In the early childhood education and care sector, staff's work includes a variety of responsibilities and activities that go beyond working directly with children. For example, individual planning or preparing play and learning activities, and working with colleagues and parents or guardians. Ensuring that staff can devote sufficient time to their different responsibilities, including tasks without children, is really important for both staff well-being and also the process quality. Across OECD countries, around half of the settings are given protected time to teachers to carry out different types of tasks to be performed without children. For assistance, that's very rare, as you can see here. In Ireland, there's no regulation on protected time for activities without children, so that always depends on the setting and the context. Something to look at. The report points to policy considerations to attract and retain a professionalized workforce. And let me just highlight 4 points here. First, initial preparation, of course. The introduction of new standards for training programs for staff provide good opportunities to review, to raise, and to harmonize the quality of programs. It's really important to monitor the impact of these recent changes to inform further adjustments. The extent and quality of practical experience as part of programs in particular needs to be carefully assessed and carefully supported. Second, continued professional development. Ireland puts a strong focus on formal types of education to raise the qualification of the workforce, but the approach to professionalization needs to be broader to reflect different needs of different staff. New staff need really good inductions that provide guidance and mentoring from more experienced colleagues to adapt to the specific work context and situations. Particular attention needs to be paid to the needs of current practitioners who want to gain new qualifications. The recognition of prior learning is another important component that needs to be further developed, maybe. And third, it's about working conditions. Attracting and maintaining a high-quality workforce cannot go without working conditions that are, appropriate with the content, the responsibilities, and also the expectations that are attached to the job. And that requires higher public funding mechanisms to ensure that this actually translates into better working conditions. I know there have been recent announcements as part of the budget for 2022, but that go in that direction. That's an important first step. And fourth, it's always about leadership. While effective leadership is always context dependent, there needs to be a strong focus on pedagogical leadership, especially in large centers whose managers might have more a business background. Leadership can then be further promoted through preparation and training, but also through monitoring and inspections. And the report also discusses how the quality assurance system can support, quality in early childhood education and care. The scope of monitoring needs to concern all aspects of process quality. Although all types of interactions are stressed in curriculum frameworks across countries and jurisdictions, not all of those interactions, which all matter for children's experience in early childhood education and care, are monitored equally. And that may then, direct staff's attention towards those things that are measured and not sufficiently to those aspects that are not covered. You can only improve what you can see, and what gets measured usually gets attention. So it's important to get that balance right and make sort of a good alignment between. In Ireland, the focus of inspection is very broad. We acknowledge that. Ireland has taken also some innovative steps to gather parents' and children's views through consultations to improve further inspection models. I think that's a great step. And starting this year, 21, parents and guardians can also give their views on the service their child attends by completing a new feedback form. Again, a very, very important step to sort of take the kind of client side into account. Let me conclude with a few policy considerations to support quality assurance and improvement in early childhood education and care in Ireland. First, on governance. Complexity is clearly an issue, not only but also for Ireland. Ireland has a split inspection system involving multiple organizations and frameworks, and each comes with different and interlinked functions. Sometimes they cause confusion for providers who have to deal separately with several and different monitoring bodies. There are also possibilities to increase coordination between them, coordination of schedules and calendars, shared meetings, joint professional development, and improvements in data sharing. I'm going to come back to that. Our review also discusses several options to bring the various functions within a single body that provides integrated care and educational inspections. It's also an issue that most childminders are not currently within the scope of quality sure arrangements, although the government has plans to regulate home-based provision. And then it's important that education-focused inspections are really extended to all center-based kind of early childhood education, as is already planned. Second, it's about inspection frameworks. Work should now be taken forward to integrate existing quality frameworks with the aim of developing a joint framework which forms a common reference point for all inspection and self-evaluation activities. Ireland has recognized the value of promoting self-evaluation in the early childhood education care sector, but staff need to continue to build their skills and capacities to undertake effective self-evaluation and also improvement planning. And third, what matters is that inspection outcomes are actually used, that they feed into sort of making things better. It's important to pay attention to increasing the transparency of evaluation and to making the results of inspections also maybe more accessible to the public, using transparency really as a driver to improve quality. And it is equally important to consider to develop and also publicize an integrated, easily accessible and user-friendly parent portal, so that all of that information becomes part of the process of delivering better services. And then finally, there's data. Data is so important to streamline the information flows throughout the entire systems. To sum up, it's great that Ireland has such an ambitious policy agenda in this sector, now with the goal to improve access, quality, and affordability. And to achieve these objectives, attention is really needed to build and implement mechanisms to ensure that increased funding actually translates into higher quality. And also to overcome, in the long run, the duality between provision for the pre-primary education and early childhood education for the youngest children. Thank you very much.
It gives me great pleasure to welcome the OECD's report, Strengthening Early Childhood Education and Care in Ireland. This important report provides a considered and timely assessment of Ireland's policies to support the quality of early learning and care. And I welcome the focus on quality, as we know it's the quality of provision that is critical for children's development and well-being. May I thank all those involved in the report. Firstly, the OECD team. The breadth of the OECD's international experience and the rigour of their analysis are why we asked them to carry out this independent assessment. I'm very grateful to the OECD for the care and effort they put into the task. May I also thank the Oversight Group who supported and coordinated the review. The Oversight Group comprised officials of my own department, the Department of Education, TUSLA, PUBL and the National Council for Curriculum and Assessment. While COVID-19 made it impossible for the OECD team to visit Ireland in person, they had meetings with key stakeholders as well as groups of parents, staff and students. The input of so many stakeholders was invaluable in ensuring the OECD review was grounded in the reality of what is happening in early learning and care in Ireland today. My sincere thanks to all who took part and to Better Start within PUBL for facilitating the OECD's remote visits to a number of settings. My thanks also to the European Commission for supporting this review. The OECD's report makes a number of recommendations on how we should strengthen policies, especially on the quality of provision. I welcome and I accept the OECD's recommendations. On workforce issues, I will shortly publish a workforce plan for early learning and care and school-age childcare. As we have the benefit of hearing the OECD's emerging conclusions during the course of their review, many of their recommendations have already informed the workforce plan. The workforce plan will set out actions to strengthen supports for upskilling and for CPD while developing clear career pathways. It will complement the Joint Labour Committee process that is underway to improve the pay and working conditions in the sector. On the funding of the sector, I will also soon publish a report from the expert group to develop a new funding model. The experts group detailed and considered recommendations align very well with those of the OECD, and already Budget 2022 has made provision to commence implementation of these recommendations. In particular, Budget 22 signalled the introduction of a new core funding stream from September of next year. This will provide a strategic new approach to investment in the sector, supporting quality, affordability, inclusion and sustainability. On quality assurance, the OECD's recommendations fit with the commitments in First 5, including commitments to develop supports for self-evaluation, strengthen the national quality improvement infrastructure, and reform and streamline the inspection system. The OECD's recommendations also endorse the approach in the National Action Plan for Childminding and align with commitments in the Programme for Government. The OECD's recommendations will be extremely useful as we plan further measures. Some will require careful consideration and further discussion with stakeholders, including the recommendation to consider bringing the functions of the two inspectorates together within a single body that provides integrated care and education inspections. Immediate actions in 2022 will include strengthening the quality support infrastructure, starting to develop a single self-evaluation framework, and working with the two inspectorates to strengthen ongoing collaboration. The OECD report both endorses work that is underway and pushes us to go further. I look forward to working with stakeholders as we set about putting the OECD's valuable advice into practice. Thank you.